If you think you're struggling with endometriosis or you've been diagnosed with endometriosis or adenomyosis, this video is for you. In this video, I'm going to share my best tips on how to treat endometriosis or adenomyosis holistically. If you haven't subscribed yet, hit that subscribe button to be notified anytime I post new content related to women's health, hormones, or holistic health. So endometriosis is a fairly common condition which affects up to about 1 in 10 women, which is a fairly high number, and its main characteristic is pain. Now, this is not our normal sort of like run-of-the-mill period pain. This pain can be very, very severe, with lots of women needing medical care from it, feeling absolutely miserable, needing high dosage of pain medicine, feeling nauseous, vomiting. It's very, very intense for a lot of women. It can be a little bit more mild than that, but a lot of women experience debilitating pain with endometriosis. So in this video, I'm going to share with you exactly what to do for it. So severe period pain can be like cramping, searing, stabbing, very intense pain that can last for several days in the period. It can last around ovulation, and it also can last at various times throughout your cycle. So it doesn't have to just be with your period. Someone with endometriosis do notice it just between their periods or on their period, but it also can be pelvic pain in various other times of the month and through the monthly menstrual cycle as well. This pain can also occur in your uterus through your period, but it also can occur in other areas like your legs, your bladder, your rectum, your stomach, your pelvic cavity, many other areas, because that endometrial tissue can actually expand outside the uterus, which is why pain can expand outside of the uterus as well. So there are other signs of endometriosis besides pain, such as urinary issues like frequency or urgency or leakage, constipation or bowel movement issues, stomach pains, nausea, vomiting. These are all other signs that could be pointing us toward endometriosis. The problem with endometriosis is the diagnosis. A lot of women really struggle to get an adequate diagnosis with endometriosis because it cannot be diagnosed in any other way than actually looking. So an ultrasound or something like that is not going to necessarily diagnose endometriosis. Most women actually have to have a laparoscopy to get in there and let their surgeon actually look and diagnose it that way, which is super, super inconvenient and why it's such a misdiagnosis all the time. Endometriosis can be a little bit of a complicated pathology because a lot of people are just like, oh, it's just like a symptom of estrogen dominance. It's definitely not just a symptom of estrogen dominance. There are other aspects at play. The first part is a lot of research has been showing that endometriosis actually has a little bit of an autoimmune component to it. So meaning that our immune system is at play here with attacking that tissue. The second part of this diagnosis in this pathology is inflammation. It's a highly inflammatory process, which is where a lot of this pain comes from. And then thirdly is the hormonal combination of high estrogen levels, low progesterone. There is research that shows progesterone can be helpful, but this is where the estrogen dominance sort of comes from. It can lead to that and it can be a part of it, but it's certainly not just treating estrogen dominance like it is with like normal period pain or heavy periods or things like that. There's a lot more components to this, which is also why it can be a little bit more complex to treat, although it's totally possible to treat it. So in conventional medicine, the basic treatment of endometriosis are things like surgeries. So laparoscopies can be kind of the first line of surgery. Also, a lot of women with endometriosis have hysterectomies, just getting that out, your uterus out. Although, like I mentioned, sometimes the endometrial tissue has spread to places like the rectum or the bladder or the kidneys, different areas in your pelvic cavity. And so a hysterectomy may or may not be the sole thing that can be helpful. Other options are birth control. A lot of doctors and OBGYNs believe that getting women on a very controlled cycle with birth control can be helpful in the hormonal complex of endometriosis. IUDs can be helpful. So a lot of women start their journey with birth control, especially our teenage girls who are struggling with this pain in their teenage years before they've had kids. A lot of teenage girls want to have kids eventually, and so hysterectomy is not the option that most women want to go with. Diet is a huge part of endometriosis because endometriosis is inflammatory and has those inflammatory cytokines. We want to eat in a way that can reduce those. So this is going to be very variant for a lot of women and can be part of the frustration of what's going on for so many women and why it's so hard to kind of get to the bottom of this. But here's some general recommendations that I want most of my endometriosis patients to sort of abide by. I think that depending on the situation, if there's more like a histamine intolerance, so there is allergies, asthma, like nasal congestion, postnasal drip, a lot of eczema, psoriasis, those types of things, and endometriosis, heavy periods, pain, things like that, eliminating dairy for an amount of time to see if that helps is definitely worth it. A lot of dairy in the A1 casein protein can be inflammatory and exacerbate histamine, which can exacerbate estrogen down the road and can cause some inflammatory cytokines to be released. So if you have never experimented with eliminating dairy, I highly recommend doing that for a couple cycles, up to 3, and seeing how you respond. Some women feel like eliminating dairy is really magical for their endometriosis, while others don't notice a huge difference. If you don't notice a huge difference with it, that's okay. You may not be sensitive to dairy, and that's fine. Dairy is such a controversial topic because it's really a great micro and macronutrient profile, meaning that it has a great amount of protein, fat, and carbohydrates. It also has a great amount of micronutrients like minerals and vitamins in it. And so if you can handle it, it's definitely worth eating and not eliminating. But if you're sensitive to it, it does cause inflammation. That can be a really great source to take out to kind of lower the inflammation in your body. You also may want to try eliminating gluten. One study found that women who eliminated gluten for 12 months found improvement in their endometriosis symptoms. So again, with a food elimination, I'm not a big fan at just like eliminating everything because A, it's really difficult to do that. Most people can't do it for a very long term because it's unrealistic and unsustainable, and we may not need to. So I'm a big fan of keeping as many foods as we can in our system if we can do that. So I would start with dairy first and then move on to gluten after that if you're finding that eliminating dairy is not doing much for you. The other thing about diet is what to add. So you want to add in tons and tons of micronutrients. So you want to get in liver supportive foods like cruciferous vegetables like cauliflower and broccoli, kale, Brussels sprouts. You want to get in a bunch of antioxidants for the inflammation. So things like blueberries and raspberries and strawberries. You want to get in root vegetables for their micronutrients like squashes and potatoes and things like that. You want to get in as many different fruits and vegetables like greens as you possibly can to get all of those different colors of micronutrients like vitamins and minerals. Secondly, you also want to eat good quality animal proteins. So your chickens, fish, beef, pork, all of that stuff is fine. It all has really great micronutrients in there as well. And you want to make sure that you're getting sort of as high quality as your budget will allow you to, so that you're not getting in extra hormones or antibiotics or things like that in there as well. Also with diet, if you know that certain foods are setting you off, like soy or garlic or onions or eggs, those types of things, consider eliminating foods that you are symptomatic to. I know that it's not the most convenient thing to eliminate foods, but if you know that you are getting digestive issues, getting inflammation, getting water retention or swelling or having worse period pain when you consume more of it, it's definitely worth eliminating to release some of that inflammation and reduce some of that period pain. So other foods to add could be things like bone broth and gelatin. That's really soothing and it has a bunch of micronutrients in there. Coconut oil can be anti-inflammatory. Manuka honey, apple cider vinegar, fermented foods with a lot of those good gut bacteria probiotics. All of these things are great for you to add to get different micronutrients in there to help with inflammation. In terms of supplements for endometriosis, this is where an individualized approach can definitely be beneficial. So working with someone who knows about endometriosis is definitely helpful and can do a little bit of hormone testing for you. So you'd want to know things like, what does your micronutrient status look like? What's your estrogen? What is your progesterone? What's your inflammation levels? Those things are all really great to know when treating endometriosis, because then we can know, like, do we need to boost progesterone? Do we need to lower your estrogen level? Do we need to work on your liver function? Do we need to increase things like vitamin A, vitamin E, vitamin C, magnesium, those types of things? So An individualized approach is always my best bet, but just as a general recommendation, I'm going to give you a couple supplements that have shown really good efficacy in a few studies. Number one is turmeric. Turmeric is amazing for anti-inflammation, really of all kinds, and because endometriosis is so inflammatory, turmeric is one of my best things. I really like a product that's called Inflammatone from Designs for Health. You can find that on my website that I'll leave in the description below. But Inflammatone contains a bunch of different curcumin and turmeric in there, and I've had good results with that. So there's a few ways that turmeric works. It helps lower inflammation. It helps also to suppress the local estrogen in your ovary, and it also helps to prevent new blood vessels from being formed, which is good. So turmeric works in 3 different ways, which is why it's one of my favorites for inflammation. I also really like using capsules of beef liver. You've probably heard me talk about this before and probably think it's gross. I promise it's not gross, but capsules of beef liver do amazing things for us. Zinc is a really powerful immune system modulator, and it's really great for intestinal permeability as well, which can be a factor sometimes in the autoimmune component of endometriosis. So zinc is great, but we don't want to take just zinc on its own, because when we take zinc on its own, it can start to deplete other micronutrients such as copper. So remember that with vitamins and minerals, none of them work in isolation, and they all kind of work together. So there are certain ones that you don't just want to take solely because of its impact on the other ones. Zinc is one of those. So to get zinc, I recommend eating animal products like animal proteins. I also recommend oysters. Oysters are a really great form of zinc, and also taking beef liver. Beef liver capsules are a really other great form of zinc. So also in beef liver are things like B vitamins, vitamin E, vitamin A, which is also a powerful immune system modulator, and several other different micronutrients that can help kind of reset your body. A lot of people call beef liver as nature's multivitamin. It is missing obviously some of the things that multivitamins have in there, but it's a really, really great form of several of your fat soluble vitamins like A, D, E, and K, B vitamins, zinc, selenium, iodine, heme iron, a bunch of great things all put together. One other thing that I think is really helpful for endometriosis is NAC. NAC is N-acetylcysteine, and I'm gonna read a study that I have. N-acetylcysteine is an amino acid, so it's in certain foods and things like that, but it did well in a recent clinical trial for endometriosis. Of 47 women, so it was a fairly small study, in the NAC treatment group, 24 canceled their scheduled laparoscopy due to the disappearance of endometrioma cysts, a reduction in pain, or pregnancy. So NAC is a precursor to glutathione, which is our master antioxidant, and is a powerful agent in anti-inflammation. So taking NAC is super helpful, and the dosage of it is about 500 to 2,000 milligrams a day. You want to be careful of too much NAC, more than that, because it can thin your stomach lining. But NAC also has the benefit of thinning mucus in your mucous membrane, so it's great for like viruses and things like that. It also helps your liver function, and it also helps to reduce anxiety. So I would start on the lower end of that. And again, this is not medical advice. Please talk to a practitioner about what would be best for you. But NAC is really, really great in my experience clinically and through reading clinical trials of helping with endometriosis. So 2 other things that I want to mention in this video is vitamin E. Vitamin E can be really helpful for a few different reasons. It's an anti-inflammatory. It also reduces free radicals in your body, and it has the added benefit for hormones of looking similar to progesterone in your body. So it helps with period pain, it helps with breast tenderness, it helps with low progesterone symptoms. It's an overall really great vitamin for a lot of period issues, including endometriosis. I've also seen really great research on melatonin. Actually, melatonin also is known as its benefits with sleep, but it's also an antioxidant. So taking small doses of melatonin, like 1 to 3 milligrams, can be really helpful in reducing inflammation, boosting your antioxidants, and doing a lot of great benefits in your body. If you take over 10 milligrams of melatonin, which is a fairly high dose, it actually can reduce ovulation, which is definitely not helpful for endometriosis. So you want to be careful not to overdose with melatonin, but taking a smaller dose, like 1 to 3 milligrams, tends to perform well in clinical trials. There are other supplements out there like resveratrol that can be promising, and micronized progesterone that some women also use. Progesterone, remember, just kind of opposes that estrogen, and so it can really help with the estrogen component of endometriosis. So some women find great benefit in asking their doctor for some micronized progesterone as well. I hope this video was helpful for you guys. If you're struggling with endometriosis, I know that it can be just such a confusing, tough diagnosis to work through with, figuring out surgical options or birth control, or can natural approaches work. I think that definitely using some of these approaches that I've outlined in this video can be really, really helpful. And remember that so much of this is an anti-inflammation sort of diagnosis, and we really just need to work on reducing that inflammation, supporting your immune system, and then lastly, working on the estrogen component of things. If you have friends and family that are struggling with endometriosis, please shoot them over this video and share this information with them, because I think that a combination of all of these things can really get pain under control and women with endometriosis to have a more normal quality of life through definitely the month, but definitely on the monthly menstrual cycle as well. Hope you guys all are having a great day, and I'll see you guys in the next one.